Thank you. Thank you very much. And I want to start by acknowledging my fellow panelists and to say how happy I am with this all-female panel. The future is definitely female. So after COVID, we will be right there. Okay, so I'm coming at it from more of a civil society perspective. That is saying, okay, equitable access to COVID vaccine for all. It's not a good to have, it's a must have. But we need accountability for all the countries to succeed. So let me get to my next, oh, I'm not getting my next slide, let's see. Okay, well, the initial challenge, we are talking of the challenges and all that. I've read very much with interest this people's vaccine, and I'm all for it. So there is the current situation, which I'm going to leave to my colleague, Mariangela Simao, who will be telling us where it is, but we are having hope, especially with the Oxford group thing. But the people's vaccine that has been touted has all those, available to all, developed and quickly made to scale and available to all countries free of charge with mandatory sharing of all the related technology as a la TRIPS agreements. But the political challenge is having that global agreement that ensures, ability to pay regardless, to all, regardless of the ability to pay. So let's look at that political challenge. To me, that political challenge requires solutions, and those solutions require accountability. So there are a few aspects of accountability that I've put forth to say no one country should be left behind in terms of participating and ensuring that we do get a vaccine, and very quickly. Now, the first aspect of accountability for countries, country leaders and everybody, is really to fulfill the commitments of primary healthcare. As we say, primary healthcare has always been there more than 40 years ago, and it is as relevant as it is, as relevant now as it was then. We're talking everything we talk about when we say primary healthcare, accessible, acceptable, but most important, with community participation in all aspects of health. And it is the one thing that talks about the vulnerable and neglected groups, so that we don't even have to go very far. We're able to then say, of the vulnerable and neglected groups, who are the first to be able to get this vaccine? We are looking at older adults, key populations. We are looking at the healthcare givers. But let's also look at the reality. The reality is that there is lack of political commitment to primary healthcare in a lot of countries. I'll give you an example. In Africa, when the primary healthcare was touted during the height of the AIDS epidemic, our leaders had said in 2001, that they're going to devote 15% of the budget to health. And actually very few countries did that. My own country did, only because we had a president who was very focused, who was very committed. And even some of us as activists, when I became a minister, I was very clear that I'm not going to go into a ministry where less than 15% of the budget was devoted to health. And indeed, I got 20%. And I was able to work miracles with that 20%. So that it's really then that reality that we are grappling with. The other reality that key populations are marginalized rather than prioritized. So you have the indigenous populations that the very primary healthcare aspect talks about. Those are still very much marginalized. We still have the key populations such as sex workers, men who have sex with men, even under COVID right now, who are not even accessing testing and all that. So that it's just that aspect that we have to look at. Another aspect of accountability, we need governments to invest in data systems as to who needs vaccine, who is infected right now. And what is happening right now, the reality is that actually very little of that is happening. There are countries who are very much contributing and going ahead with testing people so that they know where they are with COVID. But others are just blasé. It's almost as if, well, those who get infected will get infected and we'll see what to do with them. And you can't do that. It's good, data systems are very much needed. For me, we have over 140 trials going out there. So, and with the 190 something so countries, I would expect that many countries will be participating in these global clinical trials, as happened during our HIV vaccine trials. We had a network and, countries were able to volunteer to say, we are in there. You see, but right now it's like, a little consortium here, another here. So as it is, it's not like every country feels that they are part of the solution, but countries should go in and be part and parcel of the solution. You cannot sit behind and watch other people do something and then at the end it's like, okay, I'm in there too. That's just not the way the world works. So we need to collaborate in research. We need to have that necessary global sharing of COVID-related data and technologies. But of course, the reality is simply that there is limited country data, there is limited collaboration in research, and of course, as a result of that, we are actually having a breeding ground for conspiracy theories where some people feel like, no, I'm not going to have a vaccine taking part in my country. Why? Because we've heard that they inject you with the virus or they do something. So if we were all involved, none of this would be happening. So it's time to now participate together. Another aspect of accountability, domestic financing. We need to have countries to have contingency plans on domestic financing. It was a surprise to everybody, but developing a vaccine is definitely not a surprise. So there should be a COVID fund in all countries, and that can at least have that global fund where every country should be able to put in and guarantee that COVID-19 vaccines are then available free of charge to everybody. The cost of the vaccine would then be shared, having been procured by the state and then distributed by citizens, so that everybody, every country I see where they would then contribute as they can be able to afford. Even if you said, well, every country contribute 1% of your GDP. If your GDP is 100,000 US dollars, that's exactly what you contribute, 10,000. And it's better because it shows everybody being, and parcel of this, rather than waiting to say, oh, there will be a global fund formed by the rich countries. There will be this, that's not the way it's going to work right now because everybody is in need. And I'm saying so because the resources are there. In a lot of our countries, there's already evidence that 20 to 40% there is wastage on corruption and inefficiency. This was just pronounced during the recent Every Woman, Every Child launch, which shows that we have the funds and it's really a question of good governance, zero tolerance for corruption, and we can be able to do that. So that's the reality, that HIV commodities, even now, they are not free. A lot of countries were not able to meet the 3x5 or the 15x15 targets, mainly because they did not put their money where the citizens are. So a lot of non-citizens were left behind in countries, even where they said, oh, we have like a 90% coverage. You find that it was for citizens. Now, in a virus situation, you cannot have something that says we are going to do only for citizens in our country versus non-citizens. We are all in the same pot. And if there's going to be any cooking, we'll all die together. So I'm giving an example of domestic financing, where things tend to be equal. In Botswana, during the 70s, our tripartite university deal, political as usual, fell apart. And Botswana had to come with a slogan, one man, one beast. I think the women were also included. But it was one man, one beast, because it's a cattle rearing country. They knew that people could have at least a beast. But if you had a chicken, If you're the poorest person, you had only eggs, you had to contribute. And they conducted enough to build actually one of the best universities in Africa, with scholarships guaranteed for citizen students. But there were preconditions, and that's why people rallied. It was that good governance, zero tolerance for corruption, peaceful, sustained democracy, and most important, respect for human rights, so that the citizens, the communities had that trust that their resources will go to where they're needed most. And we need that kind of thing in countries where even if you said to every citizen, contribute $1, they would know that as we do this, it's going to go towards the purchasing COVID vaccines for us. So another aspect of this time global funding, but on a bilateral thing. These are some of the things that we can be able to look at. For example, PEPFAR. It was really bilateral agreements with poorer countries, and this has placed actually more than 10 million people on ARVs. So these are the things. And then of course we have the global fund, but with, and that one is already there, but we can also have countries contributing that small portion that would guarantee that COVID-19 vaccines and tests are available to everyone free of charge. Now, the last aspect of accountability is community engagement. We have the painful lessons from the history of the AIDS response of relating to unequal access are evident right now. And we need, therefore, those victories, the same victories that the activists had, so that they fought for access to affordable medicines for all. We need that kind of civil society in every country that can say our government invest in vaccines, for that. Of course, the reality is simply that COVID activists are not there. And if we do later have COVID activists, will they be funded to be able to be as powerful as the AIDS activists? We need to look at that. So it is one thing that we need to look at. So in conclusion, it's ready to say that, yeah, a good vaccine, a people's vaccine is not a good to have, it's a must have. But for all countries, we have preconditions for success. And that's really the political accountability that adheres to the principles of primary healthcare, investing in data systems, ensuring collaboration in the vaccine research, as well as investing in domestic financing. Community engagement is essential, but we need to ensure that every country is funded to ensure those human rights principles of access to all. Thank you very much.